Speaker, yesterday I received this message from a very respected businessman in Knoxville, Randy Greaves. He wrote, "I just received a letter from Humana stating that they are leaving the state of Tennessee next year. This leaves no one to write individual health policies in the state. Aetna only writes group policies, and they may withdraw as well. Please let anyone with a vote know that families are being failed miserably, as you already know." He continues, "The insurance that Humana wrote for my family in 2017 required that we pay the first $37,000 between premiums and the deductible before insurance would contribute only 50%. He said it was basically worthless, and now they won't even make that lousy policy available because people on subsidies, mostly with no personal accountability for their own health, cost a fortune to the rest of us. Obamacare may have helped 20 million people, but it's hurt 200 million people in the process." About a month ago, the Irish Times, the largest newspaper in Ireland, reported that they had over 660,000 people on waiting lists for health care. That's in a country of less than 5 million people. You multiply that times 60 or 65, and you've got the United States. Medicare, when it started, when it was first passed, there was an official CBO prediction that it would cost $9 billion after 25 years. Instead, it cost 12 times that after the first 25 years, and now it costs 6 times more than that, or about 70 times more than the original estimates. California, as liberal and left-wing as that state is, a few days ago I read that they tried to pass a health care or medical care for everyone bill. They had to withdraw the bill because they found out that it would cost $400 billion for the first year. You multiply that times 10 or 11, you're talking about the whole United States. And we're having trouble affording the Medicare that we have now for 14% of the population, so Medicare for everyone is not going to work in this country. We took what was a very minor problem for a very few people in the mid-'60s and turned it into a major problem for everyone, so that now only Warren Buffett and Bill Gates and people like that, multi-billionaires, can afford health care. And the reason is that anything the federal government subsidizes, the costs just explode because you remove the incentives and pressures to hold costs down. The American people don't want a Russian, Cuban type of medical system in this country. They don't want a totally federally run system like they have in so many countries, and with medical care that's not even a fraction of what we have. We are still under Obamacare today, and it's not working. These insurance companies are pulling out all over the whole country, and the Washington Times reported yesterday or day before that according to the Department of Health and Human Services, premiums went up 63% in Tennessee in 2017 alone. Mr. Speaker, this system is not working. We need to move more in the direction of a free market medical system if we're ever going to hope to bring down health care costs for the American people with the kind of health care that everyone is demanding and wanting and that we want to give to them. I yield back the balance of my time.